Hi, I'm Joyce and I'm an instructor at Breathe Pilates. Sitting for long periods of time at a desk can create a lot of tension in your lower back and in your hips. In some people, this can also cause sciatic nerve pain and maybe some weakness and discomfort in the legs. So today I'm going to show you a very quick mobility flow which will help to restore some dynamic mobility to your inner and outer thighs, as well as release your deep lateral rotators of the hip. So we're going to just start sitting upright. Find a sturdy chair. Keep your feet on the floor. Take a breath in and reach the crown of your head up towards the ceiling. Then as you exhale, pull the belly button in and start to go into a cat stretch. Take another breath in. Let the tailbone angle backwards and think of a thread attached to the front of your rib cage, reaching to the far side of the room. As you exhale, we'll flex the spine one more time, taking care not to move your head too far forwards. So keep a little space between the chin and the body. Inhale and go back into your spinal extension. And you can do this about 3 to 5 times. So for your second exercise, we're going to work on external rotation of the hips. You'll start with your feet in a parallel position and then lift up the heels and just let the knees point outwards to the side. So when you move your hips into external rotation, you try and not move too much from your knee or your ankle on your toe. And you want to make sure that the movement comes directly from the hip joint, which is where your thigh meets your pelvis. You're going to do this about 5 to 8 times, focusing on really pressing outwards with the outside edge of the knee and the thigh to get the external rotators working. Now you take your feet slightly wider, maybe as wide as your chair. Try and make sure that you're sitting in a neutral position again the whole time. Lift the heels up and this time rotate your thighs inwards into internal rotation. Once again, you're going to make sure that you don't move from the ankles or the knees too much for this. And just try and really isolate that feeling to the outside of the hip joint. We'll do this about 3 to 5 times again. And we'll move on to your next stretch, which is what we call a figure 4 stretch. So you take one leg down on the floor, take the opposite leg up, and rest it onto the front of the kneecap. If you find this range a little bit hard to attain, you can always move your supporting leg lower down. Try and keep that right knee reaching away from the body, keep your spine neutral, and just hinge forwards and backwards. You'll feel the stretch go into the outside of the right hip, which is your bent knee. Try to make sure we don't round the spine too much when we're doing this. Just keep your neck and shoulder relaxed. And we'll do this 5 to 8 times, and on your last stretch, we'll turn this into a static stretch. Hold the position and take a couple of deep breaths. Thinking about the crown of your head reaching in one direction and the tailbone reaching in the opposite. Okay, let's change legs. I'll change the angle so you can see what this looks like from the side. Left foot's going to come in front of the right knee, and we'll just hinge forwards and backwards. You can take one breath to move forwards and exhale to come back upright. On your last stretch, we'll hold that position for 2 or 3 deep breaths. Okay. For our next stretch, you may want to find the corner of your chair, and then we're going to take both legs into external rotation. So that means your left kneecap's going to point to the left side of the room, and your right kneecap's going to point to the right side of the room. We're going to take your left leg into internal rotation, and really think about driving the left hip into external rotation before you switch to the other side. And down. You'll do this about 5 to 8 times, or as many as time allows. Again, thinking of moving from the outside of the thigh. You shouldn't feel too much work into the ankles or the knees. Everything should be just isolated onto the sides of the hips. Let's just do this one more time. And then relax. Thank you.